As you know, that Amapiano is just rocking the world by storm. Before that, you heard Stand Strong by Davido. Bring us exactly 20 minutes after 11 o'clock Central Africa time right here on Channel Africa. We're going to be having our conversation with Dr. Sandile Mpungose. And Dr. Mpungose is a specialist prosthodontist and the head of a Prosthodontic clinic unit at the University of Pretoria. So you're going to be having a chat to him in light of soft life, self-care, trends and hacks in just a moment.
Darubini ya Afrika na I am Henry Shakif.
Pengine wa Namibia Nandi naitwa tayari mkwisha wasili.
Bila shaka kama ambavyo umedokeza hapo mwanzo kwamba tuna ziara hii ya kikazi kutoka serikali ya Namibia ambapo mgeni atapokelewa na Rais Samia na wajumbe mbalimbali. Sasa labda kabla ya kuendelea kuangalia ziara hii mahusiano yake lakini faida zake kwa sasa, labda turudi nyuma kwa haraka tuangalie mahusiano ya Tanzania na Namibia yalivyokuwa na mpaka sasa. Mahusiano haya hayakuanza jana wala leo.
Unadhani sasa nini kifanyike katika kuimarisha diplomasia baina ya mataifa haya mawili kwa ufupi?
Kwa ufupi kabisa, hatua ambayo pia Rais Metumbo ambaye alichukua kufanya ziara hii ya kikazi ya Tanzania analeta ujumbe mmoja kwamba yuko katika hatua za mwanzo za utawala wake tunafahamu, na hivyo anajenga mahusiano ya kimkakati na ushirika wake karibu na Namibia. Lakini hii kwa haraka Afrika inaelekea katika kipindi cha kuimarisha biashara za ndani.
Darubini ya Afrika kila Jumatatu hadi Ijumaa kuanzia saa 11 kamili hadi saa 12 kamili jioni majira ya Afrika ya Kati.
Get Channel Africa on DSTV Audio Bouquet. Channel 802. Your favorite songs, your favorite stories on your favorite station. This is Channel Africa.
It's time to take care of yourself. As you know, it is time to have those kind of conversations right here on Out and About. It is all about soft life, self-care, trends and hacks. And in light of that conversation, we're going to be having a conversation with Dr. Sandile Mpungose. Listen, he is a long name, okay? In his specialty, he holds an MChD in Prosthodontics from the University of Western Cape and has previously served as head clinical unit at both UWC and Sefako Makgatho University. He is an associate of the College of Prosthodontists of the College of Medicine of South Africa and currently serves as the chairperson of the HPC SA Dental Committee. He also is the president of the Association of Prosthodontists of Southern Africa and a fellow of the international team for implantology. And Dr. Mpungose is deeply committed to advancing dental education and specialist training in South Africa. His research interests span digital dentistry, implantology, and complete denture. Doctor, you finish it off.
Prosthodontics.
There we go. Oh man, it's such a tongue twister. And he has supervised numerous postgraduate students through their master's and a doctoral degree. He has presented nationally and internationally, and beyond academia, he maintains an active private specialist practice. Good morning to you. I'm kind of like sweating to get through that long word.
Good morning.
What is that all about? Please tell me.
Prosthodontics?
Yes, please.
Okay, well, in a nutshell, it's prosthesis. So anything that has to do with
prosthetics in a way, right?
Yeah.
But why put such a fancy word? My gosh, it's such a tongue twister.
Yeah, but I guess, look, there is prosthetics well as a profession.
Right.
So this really deals with head and neck prosthetics. So anything in the head and neck region that is of a prosthetic nature, then you would fall under prosthodontics.
I mean, you look very young, right? And when I look at your resume in terms, and this is just like the tip of the iceberg, you must have studied for a very long time.
Looks are deceiving.
Are the looks deceiving? How many years did this all take in order to achieve what you have achieved?
5 years undergraduate training to be a dentist,
Right.
community service, and then you have to work for a number of years before you can go back into another 4 years of specializing. And yeah, then whatever else comes thereafter. So I think really academia per se, 9 years.
It's like almost like your life. It's been your life, and you're probably going to continue. So, I mean, why dentistry?
Sure. Well, I really wanted to be a lawyer. My mom said no.
Really? Wow. Okay.
Law didn't have a good name, I guess, back in the day. But yeah, my mom said no, and I had a childhood accident. My dentist then sorted me out, and I found it quite interesting. So, and I've never looked back since I chose it. Yeah.
Okay, so I'm going to ask you a very important question, and I'm sure our listeners and people watching right now are probably wondering the same thing. Because of the space that you're in, every time when you talk to people, right, is the first focal point for you the mouth area, like, the teeth, to check what's the situation there? Is that
For me, yes, occupational hazard, but strangely enough,
yeah.
What we don't realize is you yourself even do it, because
No, I don't actually. Hey, honestly, I don't. I literally don't.
Scientifically, they say when you look at one in the face, one of the most glaringly obvious things that one will look at are teeth. And if there's a missing tooth or there's something wrong, it's the one thing that even the layman on the street will notice.
Honestly speaking, it's something I really don't notice, because there's two things I don't notice that are very, very obvious. It's someone's height and teeth. And I've noticed that's what people notice the most. So it's such a weird concept for me. And I mean, if our teeth could talk, what would they complain about the most?
I guess not being taken care of appropriately, because they know so much about you. Lots of your bodily functions, your activities on a daily basis, are actually centered around your mouth, and the teeth play a very intricate part in that. There's a lot of bodily functions, diseases,
right,
etc., that you can easily pick up just from looking at somebody's mouth. So if it's an aspect of one's life that needs to actually be taken care of a little bit more than what we do.
So would you say in actual fact that the mouth carries the most bacteria?
Oh, of course, without a doubt.
Whoa.
Yeah,
Okay.
it's of the human body, the mouth is probably, unfortunately, the one with the most bacteria.
Eish. Yeah, and
We do a lot with our mouths, don't we?
Oh man, what is the most surprising thing you can tell about a person just by looking inside their mouth?
Sure. Yeah. Well, I guess there's a lot you can pick up in terms of their health.
Like internally as well. Are those things that you can pick up?
Yeah.
Wow.
Just from the way your gums are, maybe your teeth as well, the nature of your soft tissue, whether you've got saliva or not. All of this can give us a lot of information in terms of systemic health, infectious diseases, autoimmune diseases, diet. So there's a lot that you can actually really tell.
What is it, you speak about autoimmune diseases. What is it that you can pick up within someone's teeth from an autoimmune deficiency?
So perhaps the thing is, I think when we look at dentistry, we always tend to assume it's only about the teeth. But so from an autoimmune perspective, it would be more so the soft tissues,
Okay.
so your cheeks, nature, how the soft tissue presents, the way your gums present, that can actually tell us a lot. We always have this saying that we need to put the mouth back into the body. For some reason,
that makes a lot of sense.
We've tended to separate dentistry as an separate
that makes a lot of sense
profession, whereas actually it feeds into it's still in your body, so and it really impacts on the rest of your body. So certain things that are happening elsewhere are easily or sometimes first picked up in the mouth, or just by looking at one's mouth.
Yes.
You can actually tell that, listen, we need to investigate other things, leukemia is one,
Really?
which often at times presents late when looking at other systems,
Right.
but from just looking at one's mouth, you can actually pick that up.
That makes so much sense, honestly. It's something that has always been at the back of my mind, but you're literally answering all the questions I've always asked myself. Dentures have been around for centuries, but what people actually use before the modern dentures? I know my mom, I speak from experience. I'm just asking for someone who's curious about this. So, because back in the days, it was like, you remove and put in a cup and...
Yeah. Look, dentures are still around, I guess, especially for me as a prosthodontist, and I think, yeah, predominantly they are used by much older individuals, because back in the day, the only form of treatment that was offered was to remove a tooth or teeth when you're in pain, but there are many other ways to manage pain, and removing a tooth is not really the best idea, actually. So dentures are still around, but obviously they can float around and are not easy to use at times. But now, with the advent of implants, we can get them much more better anchored so that they move less, and somebody can get back to having good oral function. Yeah. So
yes,
they're
that's
still around.
so true. No, I've seen that, because like my late brother actually had an accident at work and lost his front teeth and had to use dentures, but they were so good that you couldn't even tell. Because in my family we have straight teeth, so it has to be so identical to the shape of your teeth somehow. But it was so beautifully done. That's how I'm like, there's no misconception on my side. But speaking of which, what is the biggest misconception people have about dentures? And are they really only for older people? We've established that they are not, because my brother used to use them. But what is the biggest misconception?
Yeah, I guess it's... I guess it's that they're for older people, and I think also maybe it's the understanding of what dentures are. Not all dentures can be removed. So just because you have a denture doesn't mean you have to take it out and put it in a glass at night and sleep when you sleep.
So you can keep it in all the time.
But there are dentures, depending on how they designed and anchored, that can stay in your mouth, and you can't remove them. You have to visit your
I think I'm gonna go for that
specialist.
as I get older. I think that's better. I don't know. When I've heard about the veneers and it sounds
easier
weird.
to keep your teeth.
Yeah. Oh my God, that's funny.
Yeah, rather than having dentures, it's easier to keep your own teeth. Hey?
No, but like, because there is that thing as when you get older, that's that thing that runs through the family, where I know in my family, we are known to have straight teeth, right? But the disadvantage is that, we have a lineage of when you get older, we don't age very well. When you get older, it's our ears and the teeth. The teeth start falling out. And I've actually seen it. Like, man, that is so sad. Those straight teeth are going. Do you know what I mean? So I can see that's where I'm probably going to go. I'm happy to know that there are ones that don't have to be removed as such, that really can be stabilized in your mouth. So for me, you've just answered a very, very, very important question, because, and that goes for any age, right?
Yeah, I think the big thing about aging, by the way, is perhaps, and why people maybe lose teeth as they grow older, is there's an issue around dexterity and maintaining them and cleaning them. So and if you obviously struggle with that as you age, you may tend to lose more teeth as you grow older. But yeah,
What causes that?
Look, as I said, teeth just need to be taken care of. With age, Alzheimer's, etc. There are health issues that arthritis. It's now difficult to hold a toothbrush. You can't clean, even if you can't clean properly.
And then you get those smaller problems.
Yeah.
Now, here's another question for, in terms of dentistry. People, is it a good thing to use mouthwash all the time and every day? Or are we supposed to use mouthwash just sometimes?
Well, let's have a quick academic lesson.
Right, thank you.
Right.
I need those. I like learning. I'm like a sponge. I like to learn.
So a toothbrush and toothpaste do one thing and mouthwash does another. They don't do the same thing.
Kills bacteria.
Right. A toothbrush and toothpaste will remove. So the moment you use your mouth or anything, there's a film that forms over your teeth. The longer that film stays there, there's bacteria in it. It causes decay. So a toothbrush and toothpaste are designed as a manual tool to remove that film,
right?
So that you disturb the bacteria and introduce fluoride, right? Now, once that happens, we're good. A mouthwash, on the other hand, doesn't have the same function. That what I just described was for your teeth. There's also something that you need to do for
Your mouth.
your gums,
Okay.
your soft tissues,
Okay.
as well as for the areas where you can't get in between, and that it then creates an area where it delays the time at which the film can then now start forming again on your teeth. So the quick lesson is, don't use a toothpaste and toothbrush then immediately use the mouthwash. There needs to be a gap in between, 20 to 30 minutes, or else from a chemical point of view, one has a positive charge, one has a negative charge. You neutralize it if you use it immediately, and there's no effect.
So actually what you're saying is that you could, let's say you've brushed your teeth in the morning like normal, because you get people that brush their teeth after eating every meal.
Yeah.
Okay. But
Not good
let's,
as well.
hey, listen, I've said that before to people, but I don't know anything. I'm just, a broadcaster. But let's say, okay, fine, you brush your teeth in the morning thoroughly, properly, with your good toothpaste, whatever. And let's say in the day, after you've eaten maybe something light, is it then okay to use your mouthwash just to refresh your mouth?
Yeah,
Would that be the
okay.
right way?
Yeah,
You see, guys, I told you, Kitty knows
But-
a little something.
Yeah, but also it is like the routine I often advise is you brush your teeth before you sleep, or shortly after you eat at night. Then before you head to bed, then you can just use your mouthwash to rinse. But then there's a gap there's a time lapse that exists in between there that you do need.
You've
And then
just made my
obviously
day. You've just
at
literally made my day.
At least twice a day, though.
Yeah, no. I mean, I like brushing my teeth. I mean, honestly, I like my teeth to be nice and white, and clean, But here's another question. Can stress really destroy your teeth?
Most definitely.
Really?
Yeah. And that's, I think, the most underrated thing that we don't realize, or we don't talk about a lot.
Really?
Sometimes people say my teeth get shorter as I get older. Yes, but not really. It's more so stress than anything, because another quick lesson, this bottom jaw is suspended by muscles, right? It's held by muscles and ligaments. It's the only bone in your body, by the way, that's floating. So what then happens when you stress? Muscle
Contract.
You get muscle activity, because it's all centrally
Through your brain,
mediated in the brain.
Yeah.
So you start clenching and grinding your teeth, and you often find as well your partner will know because they'll tell you that you grind your teeth at night. Or the other thing that you will notice is that when you wake up, you tend to have tenderness, or your muscles are
around
tense
your
in the face.
jawline, yeah.
So that's all stress related, and the outcome of that is that you start grinding your teeth down. Then they get sensitive, and then you end up losing. So stress really does play a big role. See it a lot in sports people as well, because then also that plus energy drinks is just a
oh
big,
man, I was hoping you were going to
disaster.
say that, because I'm a professional athlete, right? And I don't grind my teeth. I don't have that problem, thank God. But the energy drinks, I'm like an addict of Red Bull. It's my friend. I love Red Bull. It just tastes nice. Really. Are my teeth going to fall out eventually?
Look, now that we know, we need to put in the measures in place, to make sure that they don't, because they ultimately, it does have an impact on the tooth surface that you have, and it starts wearing away. So we do need to find a protective mechanism for you, where be it with something physical that we introduce as a physical barrier, or just a change in behavior. It's small things at times with with the mouth, that sometimes it's just a change in behavior that can prolong it for. I'll
just chuck a mouthwash.
I guess just drink it through a straw.
I do. But Doc, listen, we have to wrap things up. Thank you so much for joining us and giving us more clarity as to how to take care of our teeth and how to take care of our mouths, because there's so much that goes in there. And for me, you just gave me better clarity. And I'm definitely going to use dentures though when I get older, because you just told me that you can drip those in a very, very nice way. So thank you so much for joining us here on Out and About.
Yeah. Thank you very much.
Oh, that's fantastic. Well, that was the doc right here on Out and About. And man, it's been a beautiful, beautiful conversation having with him. And thank you so much for joining us. That was Dr. Sandile Mpungose.
Your mornings are brighter with me, Chabu. It's a perfect way to kick